right, hey guys, Dr. Sauter here. So you probably saw a video where I was basically asked what I felt the best quality procedure or the technique that would give you the best quality results with respect to FUE and FUT. And my answer, short answer, was FUT. And what I talked about in that particular clip was FUT, or the strip, provides a very consistent procedure, right? It's consistently reproduced, which gives you better consistent results. Okay, that was one of the points. What I mean by that is FUT requires a team, and if you have a very qualified team that is with you consistently, that works with the surgeon consistently, then you're going to see very consistent results, right? These folks work together, they're going to cut the grafts very precisely, they're going to be placed very precisely, and you're going to get a really good outcome, which is what we do here. The other point was that because the FUT, or the strip, stays in this safe donor area, which is the concept of hair that never goes away. So if you've seen the baldest guy, right, like they have, you know, nothing here, but they always have that little wreath of hair. That wreath of hair is basically the safe donor area. That hair actually will never go away, and if you transplant it, it never goes away either. So it's basically a permanent result. If you stay within the strip or the FUT, then that means you're transplanting that hair, okay? Unlike FUE, where you actually take hair from all over the place, you may step outside of that safe donor area for that particular transplant. So that's why, you know, if you're comparing it, you know, neck and neck, the FUT is gonna be better. And the last is because you actually preserve your normal graft anatomy when you do a strip. And what do I mean by that? That means that a strip is harvested, and you have basically the tissue that's under a microscope dissected out of, the hairs are dissected out of the skin. So if there's a 1-hair graft or a 2-hair graft, 3 or even a 4-hair graft, then that anatomy is preserved with the strip. You cannot do that very effectively with FUE. Now, that being said, we do both procedures here. I do FUE and I do the strip or FUT, and there are some advantages to FUE. Okay, for example, if you wear your hair very, very short and you can't tolerate an incision or a scar from FUT, then FUE may be the only option. I do a lot of military personnel or servicemen where they have to wear their hair pretty short. They can't do a strip surgery, and so that's the only option. The other advantage to FUE is if you do it in small numbers, you actually can stay within the safe donor area that I just talked about. And so I do limit my FUE. I don't do these 4,000 megagraft sessions because you actually can pretty effectively deplete your donor and get a very poor outcome. So when you're really considering FUE versus FUT, it's not just a matter of, okay, you don't want a scar. It's actually much more to consider than just that, okay? So don't let people talk you into a procedure that everyone says may be better without having all of the options before you make that decision.